So the most common orthopedic injuries that I see are typically, from an elective standpoint, as an outpatient in the office, knee and shoulder problems mainly. From a knee standpoint, arthritis is a fairly common problem. Acute injuries would include meniscal tears or ligament tears, such as the anterior cruciate ligament, kneecap type of pain. It's termed patellofemoral pain, whether that's a chronic type of thing or an acute injury such as a patellar dislocation or something to that effect. But frontal or anterior knee pain, patellofemoral pain is really common. From a shoulder standpoint, I would say that rotator cuff pathology is probably the most common thing that I see. It runs the spectrum from tendonitis or partial thickness tearing to full thickness rotator cuff tears. And they kind of run the spectrum from small, medium, large, massive. There's a very broad spectrum when you talk about rotator cuff injuries, and that basically the rotator cuff is just a group of four tendons that connects muscle to bone, the outside part of the upper arm. But in addition to the rotator cuff, acute injuries would include injuries to the labrum, which is the ring of cartilage around the shoulder. You can see that a lot of the time in football players who dislocate their shoulder can injure their labrum. Those are probably the two most common things. And again, arthritis is another common problem, whether it be a chronic sort of issue as people age, or sometimes it's a post-traumatic problem. So people who kids who sustain injuries maybe in high school or college that then go on to develop arthritis type symptoms as they get older. And basically all arthritis is a wearing down of the articular cartilage, or the lining of a joint. And it can progress in different phases, and not all people that have arthritis on x-ray are symptomatic. So it can kind of, it's variable in terms of how patients present or how symptomatic they become from any sort of arthritis or osteoarthritis.